Welcome to the Hawks Health Hacks Podcast, your trusted source for wellness, fitness, and healthy lifestyle insights. We believe in empowering you with knowledge to take control of your health. Join us as we explore the latest in self-care, share expert advice, and guide you on your journey to optimal well-being. Let's embark on this path to a healthier you together.
Well, welcome back to Hawks Health Hacks. I'm Charlie McDermott, the producer, and as always, we have Dr. Anita Haque. How you doing today, Anita?
Great, thank you. How are you?
Doing terrific. As always, I'll tell you, what we're going to talk about today is, I think, so important. I mean, all your topics are so important, but I think this is one that maybe doesn't get the attention it needs because well, I'm not going to, let the what do you say? I'm not going to spoil the surprise here. So I'm going to let the expert get into it. But for your listeners today, we're going to be talking about posture, something we all know is important, but many of us struggle with, Dr. Haque. So let's start with why. Why is posture so important for overall health?
So I like to say this to my patients in a way that's easy to kind of get in your head, which is this. A ladder is only going to work best when it's in proper positioning.
Yeah.
Your body, your structure is going to work best when it's in proper position. And your structure, meaning your posture, how you stand, how your positioning of your joints are, your structure impacts your function. So I always like to make sure that you understand posture is your structure, and your structure is the foundation to how well you're going to function. Just like anything else, a bridge is not going to work well if it's not structured properly. It could fall, right? We've heard like bridges falling. That, of course, is not the first time. So that's why our posture is so vital. And actually, Charlie, I would take it a step further that posture now has become, or bad posture rather, has become a new pandemic because of all the tech that we use. We're affecting our postures in a really negative way, even more now at a rapid rate than we were, say, a decade ago. Yeah. So that's why posture is so vital because, you can't be at your optimal level of wellness, function, motion if you're off kilter. That's really the short end of it all. If I sum it up for our listeners here, your posture is going to impact how you feel, how you move, and how well your body is communicating to each other, meaning the brain to the body. It affects that tremendously.
Good. So yeah, and again, I think for most people, when you say it that way, they go, oh yeah, but it's not like front of mind, right? So we're not thinking posture. Fortunately, my wife stays on me to, keep my posture aligned because she knows how important it is. Yeah.
And
So
it's even more important now because in my practice, particularly, I am getting younger and younger patients coming in complaining of what? Neck pain, shoulder pain, like, headaches. So it's usually like between the mid back, the tightness there, the tightness in the neck. Sometimes it can even lead to like pain down the arm, numbness, tingling, carpal tunnel. That is all part of what we call in my profession in the medical world as well, the term tech neck. So basically it's all the tech that we're using constantly, screens that are making our heads look down, right? We're always looking down at our phones, and most of us are in that posture for several hours a day. And it starts now, Charlie, at a really young age. I'm sure that many of our listeners have seen babies, toddlers holding on to mom or dad's, phone or screens just so that mom and dad can maybe get a moment to do something. I see I practice all the time. Parents are coming in while they're getting their adjustments. Their kids might be there. And what they're doing is they're looking down at the screen, mom's screen, right? Looking at a game, a show, or something like that. And then come 13, 14 years old, these young kids that have been doing that at a young age age. Now they're having neck issues, pain between the shoulder blades, and presented postural issues that parents are very concerned about, because what are a lot of kids doing? They're gaming. They're not going outside and playing with their friends. They're playing with their friends on their screens. So this has definitely become an epidemic that I'm treating on a daily basis with a younger population, not just the older population. So yeah, it's that's why this topic is so passionate for me to speak about. It's kind of the top thing that I work on with every single patient, even a patient that may come in, Charlie, for sciatica. They have lower back pain radiating down their leg. Part of their treatment plan, I'm still working on their posture, because the top neck affects the lower part of the spine, the lower part of the spine. So everything connects with your posture.
Yeah. Now, I think you've touched on this, but I want to make sure we don't miss it. What are you seeing? What are the most common posture issues you see in your patients?
So I think the most common thing is the fact that there's pain or stiffness associated, but commonly it's the shoulders rounding forward like this, right? Because we're holding stuff in front of us, like I said, our devices.
Yeah.
That's step one. The second most common that kind of goes with that is the head or the neck. And I'm just going to turn to the side just in case anybody's watching this right now, that their head or
Oh,
their ear is no longer lined up with their shoulders. So if the shoulders are back, the ear would be lined up with the shoulder. But often we're seeing the head go forward, the hump come at the back of the neck. That Dowager's hump is what it's called. It's not just for older people now. We're seeing it, like I said, in younger people. So it's the rounded shoulders, the forward head look, kind of that posture that it even mimics a pre-Parkinson's posture. Parkinson's, you're rounding kind of like a worm forward. So that is the most common thing that I'm seeing in terms of what does it present with. And the symptoms are, like I said, the stiffness in the neck, tightness. And a lot of kids too, Charlie, are talking about headaches, right? Because, they're leaning their necks forward, and it's not just headaches from their structure. Sometimes it's headaches also coming from eye strain, looking at those screens, and that vision is also affecting, or the ability to try to focus on small words or things on the screen for hours is starting to cause more strain and more postural issues. So they kind of go together.
wow.
Mhm.
So how do
Lots to
these,
unpack there, right? Lots to
I
unpack.
mean, yeah, and especially, starting so young nowadays. So, which leads to this next question. How do these posture problems affect our bodies in the long run?
So there's a couple things that I noticed lately as a huge pattern. One is a lot of times the postural issues start, and it's so slight, so subtle, that us humans, we're adaptable. We're easy to get used to even negative things. For what I mean by that with posture is it starts kind of small, the stiffness, the tightness, and us humans, we're good at ignoring those symptoms. If it's tight, it'll go away. I still want to get what I'm doing on my screen done. I'm going to ignore it. So it would be simple if we were like our pets, like cats and dogs, they get up and stretch all the time, right? If they
Yeah.
listen to their bodies, they're a little bit more in tune to not, ignore that. Whereas us humans, we can ignore it. So what that will lead to then when we ignore it after a period of time, those symptoms start to become more enlarged. So now we're talking about more pain, more sharp pain, maybe more stiffness, more restriction in the range of motion. But again, it's so subtle. It's like taking a frog and putting it in lukewarm water, and then you're cranking up the heat, and eventually it's boiling in there. So that's a lot of times how postural issues can present. We can get adapted to the stiffness, the tightness. We can ignore the signals of our bodies until it becomes more catastrophic. And that's usually when it becomes more catastrophic that patients are seeking care. They're seeking out maybe my help or someone else, a doctor, to look at what's going on. I'm having neck pain now.
They can't ignore it anymore, right?
Exactly.
Yeah.
So, which is why we're here talking about this, because if we can avoid that from happening and put some things into place, simple things in place with your posture, then maybe we can avoid some of those catastrophic issues that can cause a lot of havoc in your life.
Love it. Love it. So then let's talk health hacks here. So what are some simple posture hacks people can use at work or at home?
Well, let's talk about some logical things that I'm sure as a listener, you might already be doing this, but maybe you forgot, or maybe, you just got off the game of doing this. But one thing that's really simple is trying to keep your devices at eye level. And it's not always easy when you're using a smaller screen, right? Whether it's like your phone or, maybe like an iPad or something like that. Sometimes you can hold it down on your lap and then hours later your head is bending down. So every time you're angling your head forward for a longer period of time, you're putting extra pounds of pressure and strain on the back of the neck. So one simple thing is at work, even at home, even with your phone, get a holder, put it up on something so that it's more eye level. See, I'm having my phone right up to eye level. So a stand could be helpful. Using maybe a bigger screen. Back in the day, they would say, oh, don't use your television. It's making your screen time, that YouTube, right? Sometimes I cast my phone screen onto my television screen so that I can look straight up or up as opposed to looking down to maybe view pictures, to do things, to get on my work, laptop, again, eye level, having it so that you're not having to look down. It's such a simple thing at work that you can do, at home that you can do, can make a huge difference overall.
I'm going to use that one. I love that. The cell phone, casting it on your big screen. That's a great idea.
Yeah.
You're full of them.
Yeah. Use these bigger screens, right?
How about the setup of like you said, we're sitting all day long. A lot of us, how important is the setup of our desk chairs, heck, even sleeping positions for maintaining good posture?
Yeah, I think posture is just beyond, sitting at a screen, because now we are driving with our shoulders forward and, we're eating like this. And then, you start with one bad postural hack and then you kind of end up being like this and then you sleep kind of like in that position. So there are many things that can be done in terms of like besides having things eye level, sometimes just taking a break every 35 to 45 minutes to sort of step back, move your shoulders back, your neck back. Again, these are simple things that we tend to ignore to do. It's the little things that can make a difference. So what I try to do is when I'm at my desk and I know that I'm going to be seated for a long period of time, I'm not moving around as much, my posture might be affected, I have my water right next to me. I'm drinking tons of water. Why do I do that? Well, it's always good to hydrate, one. But two, when I drink more water, my internal bladder starts telling me you need to use the bathroom. And that sometimes gets me up. So sometimes it's a 2-for-1. It's a win-win situation. Hydrating more when you're at your screens will kind of push you to get moving around, putting a timer, maybe an alert on your phone or on your laptop if you're working there to say, every 30 minutes, stretch, having stretch breaks. And I know sometimes I ignore my stretch breaks that come up too, but having that reminder does get me to move around and do just some simple stretches like this. You just take your hand, you pull your head over to the side, take a deep breath. Yeah, try this with me, Charlie. You lean your head over to the side, one deep breath in, and when you exhale, take your chin down towards your chest, and you'll start to feel kind of the back of your neck and shoulders also releasing. And then of course, I'm going to repeat on the other side. So breathing is important with your stretching. A lot of people hold their breaths and they don't get the advantage of improving their flexibility. So pulling your head over, take a deep breath. And when I exhale, I kind of look down with my head and shoulders, and that's going to kind of release some of the neck and shoulder. And just doing that already, I want to sit up taller.
Right.
Do you feel the difference? It kind of releases. Simple, but we took 10, 15 seconds to do that. Now I can get back on my laptop and not feel so strained, right? Simple things like that are easy to do.
Yeah. Any other stretches or exercises you'd recommend for just those quick breaks?
This is another quick break that I do constantly, whether I'm standing or sitting. So just so that I can make sure I demonstrate this for the viewers that might be watching this, and I'm also going to detail explain. But what I like to do, interlace them behind me with my palms facing up. So I have my fingers like this. I'm going to interlace my fingers. And then what I'm actually doing is I'm pulling my arms away from my body. At the same time as I'm doing that, Charlie, I'm looking up. So I'm basically pulling my shoulder blades back, lifting my arms up and looking back up to the sky or up to the ceiling. Take a deep breath in. And then when I exhale, I release it. And what I'll notice is my shoulders are sitting further back. Such a simple thing. It feels good. And then just getting that extra breathing time in, right? Like a lot of times we're not even breathing enough because we're kind of shallow breathing. So having a stretch with your breath can help kind of give you some energy. And then when you go back, your shoulders are back. So 2 easy stretches. And that stretch I just showed or demonstrated where you interlace your fingers behind you, you could do it seated. You could do it standing up. It's a quick way to get the rounded shoulders to go back where they need to go, which is what we want. Yeah.
I am using them both. I love it. Thank you for that.
You're welcome.
So, how about chiropractic care? How does that help with posture correction?
So that is, of course, my
Yeah.
exciting part of my passionate excitement. So what chiropractic care does for posture is a few things. What I personally do in my practice is, when someone comes in with neck issues, we always are checking posture. So in order to check posture, we check the feet, the knees, the hips. How's everything lining up? Okay.
Mm,
Now, once we figure out where things are off kilter through examination, possibly even through x-rays, we do digital x-ray, then I can mark and see what is the curve of the neck. So from the side view, when we look at an x-ray or looking at someone's side view of the neck, I mentioned how the whole of the ear should be lined up with the back of the shoulders, as long as the shoulders are rounded.
mm,
And on x-ray, we want to see like a banana shaped or reverse C-shaped curve in the spine. It's about 35 to 45 degrees is the angle of the neck on a healthy normal x-ray. If we are lacking that curve, then we'll put into play adjustments, meaning I'll actually work on realigning the vertebrae to elicit more of the curvature through
mm.
the actual hands-on approach. That's one step. Second thing that we do is traction the neck. So we have devices that we'll use in our practice that are very gentle, that basically it's a stretching mechanism so that instead of looking down all the time, we're stretching the neck
Yeah.
back to promote that curvature and
Yep.
obviously promote healing. We will also maybe provide things like straps to hold the shoulders back. So someone who's maybe at their computer for hours a day, they can actually try to keep that better posture for a longer period of time. There are pillows that we might recommend for certain patients to use nighttime to be therapeutic postural time. So as we are ruining our postures all day long, to have something with a curve in the pillow to help promote proper posture for 7, 8 hours a night can also be a
Mm,
great tool to undo some of the things that we're doing, screen time that we can't get away from throughout the day.
yeah. Wow. Good. Good. So, yeah, I've seen those straps, and I've often thought, wow, is that something that you would recommend, like you would wear all day long when you're in front of sitting at the desk to help with posture?
Yeah, so I use a strap called Posture Medic. I'm no affiliation in terms of like,
Yeah.
that's just what I find very, very helpful because it does sit around, your shoulders, but it's also a great like stretching band that you can also use for exercises. So that's actually something that we will use in our practice and give to patients. But I don't recommend to patients to use a posture band all day. One, it's very challenging, Charlie, to do that. It gets fatiguing, especially if you are rounded forward. So
Mm,
I recommend 30 minutes at a time to start.
yeah.
And then if a patient can get to an hour and then take a break for 30 minutes and put it back on again, that's a better way versus trying to do too much at once where a lot of times then you won't do it at all if it
Yeah.
hurts. And
Yeah.
sometimes as we're correcting, spinal issues or muscular skeletal issues, postural issues fall into musculoskeletal, it can be a little bit uncomfortable. It's like starting a new exercise. It can make your muscles sore. So we don't want to overwhelm if you're used to scrouching forward
Yeah.
to just try to push it back 24 hours a day, that may not be the best approach. So but I do definitely recommend bands like that, shoulder straps, if someone wears them,
Yeah.
to
Yeah.
use them to help them a little bit with that bad postural formation that we're all unfortunately getting into.
Mm, mm. How about all your experience over the years? What comes to mind, a success story that you've helped a patient who had posture issues kind of get back aligned?
So, I have plenty of stories of postural issues like this. And the reason why I say plenty of stories is because we take x-rays before and then we take
Mm,
x-rays at the end of the treatment plan. And it is amazing to see the difference of the curvature coming back. But in particular, I'm thinking about one kid. I say kid, he's not really a kid, he's 21, but as old as I am, I think a 21-year-old's a kid. But yeah, he's young adult, 21-year-old. He came in complaining of neck pain, headache, and actually was getting some more tech neck symptoms like wrist pain, thumb pain from holding the phone, texting all the time, swiping, so there was like a whole like kinetic chain of neck, shoulder. So we started treatment on this young man, and he was in college. So what are you doing in college? You're studying, you're looking at your screens even more, right? Your head is down. So definitely perpetuating the problem. So we started treatment, and he started to feel tremendously better. Within 2 weeks, he noticed that he was having less symptoms, less discomfort. And guess what happened, Charlie? On one of his visits after his adjustments at my office, he calls us about an hour later saying, Dr. Haque, I just got rear-ended and I was in a car accident. So he comes back around, and we take a new set of, examination tests to see how he was doing. Like I said, he had a lot of shock, a lot of pain in his neck, even though he was already getting better 2 weeks in. We took a new set of x-rays. So another thing that people don't realize is whiplash injuries, whether it's, from a car, sometimes it's through sports injuries, falling off a horse. Where I live, a lot of people do horseback riding. Those can cause whiplash injuries, which can affect the posture or the curve of the neck. So we had found with this young man that even though he was getting better after his car accident, it messed the curve up of his neck even further. And so we are treating him now kind of on a separate case. Yes. So this kind of got complicated. This is why I wanted to share this story. And then we go forward now another 90 days. Okay. So it's 4 months in, we take a new x-ray. He is completely on the reverse side. So his neck curve looks back into normal condition. So he went from basically having a 10-degree neck curve back into a 37-degree neck curve in a matter of like 4 months, even with the extra injury. But that was with not just chiropractic treatment, Charlie. We also incorporated some strengthening moves, some rehab to support the muscles, the postural band, the pillow, the device for him to kind of use every night for 30 seconds to get his neck curve or, traction to come in. So there are things that can be done, even though he was still in college during the time. We saw significant progress in a short period of time. Yeah.
Wow. Amazing. So before we wrap up, what's one simple posture hack that our listeners can start using today?
One thing that is so silly to say, but is so powerful, Charlie, to help your posture. I know I mentioned tips about raising your screen, bringing your phones to eye level, some stretches, but the simplest thing that we all can, do every day for 1 minute is to stand up against the wall with the back of your heels, the back of your pelvis or your glutes, your buttocks, okay, up against the wall, so a straight wall behind you. You back up your shoulder blades to the wall. And most importantly, you back your head up against the wall. So you're basically kind of like in the soldier military position, having the back of your head, the back of your shoulders, the back of your glutes, the back of your heels, all up against a straight wall. And watch a Netflix, watch a commercial. So basically a minute. If we did this one move for 1 minute, it strengthens all the back muscles that we're putting forward constantly to pull back those muscles. And just a minute a day, Charlie, can provide significant like postural improvement. So what a simple hack. Stand up against the wall. You can go longer than a minute, but if we just strive for 1 minute to hold that upright posture per day, at the end of the day, at the beginning of the day, both is even better. The ability to hold your head and shoulders back and avoid the slew of health problems that can come with postural issues can be significantly reduced.
Wow. Wow. Dr. Haque, you knocked this out of the park. I mean,
you tell I'm passionate about this topic or what?
I'm supposed to be the host here, and I'm taking all these notes and going, oh, I'm going to do this and I'm going to do that. And I'm doing the exercises and like my head, my neck feels so
better. Yes.
Yeah. And I'm at the end of the day, as you know, and it's relieved a lot of tension and stress. Good stuff. And I'm going to order, it was the Posture Medic. Is that correct? Yeah.
And also this information always on my website, which I'm sure you will also post.
Love it. Love it. Well, until next time, wishing you the absolute best.
Same to you and same to your listeners. All of our listeners today, keep those shoulders back, keep your head up, and keep your screens at eye level, and you will feel much better.
Thank you for tuning in to the Haque's Health Hacks podcast. We hope today's discussion has provided valuable insights into achieving and maintaining your health. Remember, your well-being is our priority. Visit us at hawkchiropractic.com or call 925-960-1960 to learn more or schedule an appointment.